ALS stands for Advanced Life Support. It's a service delivered by a state of Florida certified paramedic. It essentially gives the patients the best possible chance for survival prior to them getting to the emergency room and being seen by a physician.
It's important that we have ALS at all city fire stations because what it does is provide the best level of service to the citizens in our community.
Fire department.
Come in.
Hey there, what's going on today?
I just don't feel really good.
Okay, what's your name?
It's recognized throughout this country, and especially here in the state of Florida, that ALS is the way to go. And it allows that paramedic to start IVs, intubate a patient, perform advanced medication therapies, cardiac monitoring, diagnosis of MIs in the field, treat a diabetic patient, a stroke patient, somebody with a respiratory ailment. It provides them with the tools to help relieve a lot of the symptoms that patients may experience. We decided it was time to implement the ALS throughout all the stations. Some of the equipment that we have that's new to the ALS engine. This here is our McGrath scope. It's what it is, it's actually a way for our paramedics to help intubate a patient. It's a small tool that's got a tiny camera on the end and a video screen. And what our paramedics do is they take this McGrath scope and they turn it on, and the video camera enables them, as they go into the patient's oral cavity to look for the trachea, they can actually see it. This is our stat pack. This is basically our mini ER, our emergency room. We carry all our equipment, a lot of our equipment in here, some advanced airway equipment. Similar to the McGrath scope before, we do have other advanced airway equipment that we use to intubate a patient. It's a breathing tube, so we have different size breathing tubes for different size patients. We have a laryngoscope blades. Beyond that, we also have a way to breathe for the patient. We have an ambu bag. Once we have that, if we need to give an IV, if we can't get an IV, we have something called an EZ-IO, which is essentially a bone drill. It takes a needle and it can drill it into the bone of a patient, and it works just as well, if not better, than an IV. Medications, we carry several different medications for the Tallahassee Fire Department. We keep all our equipment in here. We have IV fluids and catheters, needles. We have the different medications. A lot of these are first-line cardiac arrest drugs. Some of them are for diabetic patients. Some of them are for people that may be suffering from different ailments. We also carry medications for pain. So the paramedic under a duress situation has to make sure that he or she has their proper training, that they make sure they have the right medication, the right dose, and when they administer that to the patient, that it does have the benefit or the effect that we're looking for. And then rear, we have a little IV kit. Essentially, this is IVs, different size catheters for different size veins. We have fluids. And we carry all this in this one little bag. It can be carried like a backpack by the paramedic or EMT. And then once they get on scene, they can open this up and go to work. The next piece of equipment I'm going to show you is called a cardiac monitor. The brand we have is Physio Control. Their model is the LifePak 15. It's an excellent piece of equipment that helps us do a multitude of things. Primarily, it allows us to take cardiac monitor leads. We have leads here, place these electrodes on a patient and try to figure out what rhythm they're in, whether in a normal heart rate rhythm or they have some type of arrhythmia that might need treatment by us. We also have a way of taking a patient's blood pressure. So it automatically inflates a blood pressure cuff around the patient's arm and gives us a blood pressure reading. One of the other little nifty things about it is it does have what's called an oxygen saturation monitor, and we just place that simply on the patient's finger, and what it will do is it will give, after about a few seconds, it will give you a patient's 100% O2 in my blood. That's a good thing. So the advanced portions of this monitor is when we do have a patient in critical need or having a cardiac arrest or maybe an MI, a heart attack, we're able to, with this modem, we can actually send the information from this LifePak to Capital Regional or TMH ER and let the physicians know this is what we have on scene, and they can be prepared for once that patient arrives for their treatment. ALS provides the best opportunity to help a patient, and it's important that we have it at every fire station. Even though we may not use it on every call, there's going to be those opportunities almost every day where we can save a patient's life.